Is there a permanent cure for macular degeneration? This is Dr. Anina Abraham from Advanced Retina Care, Hyderabad. I'm going to show you the picture of the retina of a person who has dry macular degeneration. This is the right eye of a person who has dry macular degeneration. What he has here is yellowish spots in the retina. These yellowish spots are called drusen. They are deposits in the layer just beneath the retina. And what happens is, with time, it atrophies the retina, and eventually something called geographical atrophy happens, in which a whole area of the center of the retina gets atrophied. And as you can understand, once an area becomes atrophied, it can never be the same again. Atrophied meaning it becomes very thinned out and dead tissue. Now, if we look at the other eye of the same patient, he has a reddish area. This reddish area is a bleed which has happened at the edge of a membrane. This is a bleed, and this helps us identify a wet macular degeneration. Is there treatment for this? Yes. Plenty of injections are available in the market now, and when the right dose is given for the proper indications, it is possible to cure this condition. How does it get cured? By becoming a small, tiny scar on the retina. So if it becomes a scar, again, it can never be a normal, healthy retina. There is a tendency for that scar to again develop a membrane and to have a bleeding at its edge. So again, is there a permanent cure? No. But this condition can become stable after the proper treatment. And the proper treatment is anti-VEGF injections given inside the eye for this membrane to shrink and eventually become a scar. If you give the injections early enough, the scar developed is so small that your black spot in your vision comes down in size. But if you delay, it becomes a massive scar and vision drops dramatically. So definitely it is required to undergo treatment for wet macular degeneration.